Welcome to the LearnSkin podcast with Dr. Raja and Dr. Hadar, where they discuss all things skin. Skin is fascinating because it affects us in so many ways, like our health, psychology, and how we connect with those around us. This podcast delves into the art and science of skincare. A short disclaimer before we get to the good stuff. Dr. Raja Sivamani and Dr. Hadar Levtov are board-certified dermatologists. This podcast is meant for educational and informational purposes only. All opinions shared do not express the views of LearnSkin. Neither this podcast nor any information contained within it are a substitute for professional care by a doctor or other qualified medical professional. This podcast does not constitute medical or other professional advice or services.
Hey Raja, how are you today?
Hi Hadar, how are you doing?
I'm doing good. I'm very excited about this episode of LearnSkin podcast. I think we have a great guest today. Can you tell us about her?
Yes, we are lucky because today we're talking integrative medicine, and who better to talk to than Dr. Guarneri. And she's a board-certified cardiologist. So she's board-certified in cardiovascular disease, internal medicine, nuclear cardiology, and integrative holistic medicine. I think her CV is way too long for us to talk about in detail, but what I'd like to highlight is that she is the founder and the president for the Academy of Integrative Health and Medicine, and she serves on the founding board of the American Board Physician Specialties in Integrative Medicine. And she's also clinical associate professor at the University of California, San Diego, so at UC San Diego. Welcome to the podcast, Dr. Guarneri. We really appreciate you being here.
It's great to be here. Thank you.
That's wonderful to have you here, and certainly a very long CV. When I went through it, I needed a break. It was really impressive. So I think you are the perfect person coming from Western medicine, doing, cardiac catheterizations, moving into integrative health, to tell us a little bit about how do you understand integrative health and medicine and when you try to approach patients?
Well, I think the way we're trained in medical school, as you know, is to practice a sort of ill to the pill approach. So the way I was trained as a cardiologist is to make a diagnosis and then come up with a surgery or pharmaceutical therapy that's going to deal with what's happening. And of course, in acute care, that makes total sense. If somebody's having a heart attack or stroke, you want to act quickly and get them taken care of. But when we think about chronic disease and the kinds of people I see in the office every day, whether it's hypertension or diabetes or eczema, or psoriasis, depression, GI issues, irritable bowel, and so on, no matter what disease or disease, if you might, that people come in with, Western medicine will approach it by saying, name it, blame it, tame it, right? Okay, you have diabetes, take this pill, hypertension, right? Take that pill. And no one is getting to the underlying cause of the problem. So for me, my whole journey has been about health creation. How do we create health? And one of the key steps that's not really taught in medical school is how do we get to the underlying cause of the problem and put a program that goes beyond pharmaceuticals into place that can slow down or potentially even reverse the process. And that's really, for me, what's key in this whole discussion.
So when you're thinking about integrative health, what do you think you've learned along in this journey? How has your practice changed? Because I'm sure there was a practice style that you had early on. Were there any frustrations that you came upon or any sort of epiphanies that made you really pursue a more integrative approach?
Absolutely. I have as you have a toolbox, right? And your toolbox, again, is pharmaceutical, surgery, maybe some physical therapy. And yet when people would come in, they would be talking about life events, being stressed, financial problems, depression, not being able to get to their ideal body weight, all sorts of issues. And all we have to dispense is medications. Pain is a perfect example. So I began to look for other options for my patients. And in the 90s, I started to do research with Dr. Dean Ornish, and we asked a fundamental question: can we reverse coronary disease? Can we reverse plaque in vessels through lifestyle change? And we started to teach people yoga and meditation and vegetarian diet, exercise, all of these things. And it was eye-opening for me because I realized not only is disease preventable, it's reversible. And it set me on this journey of saying, okay, we have all these quote unquote diagnoses. So what can we do to treat the whole person, get to the underlying cause, and put programs into place so that people can be empowered to learn and take charge of their health? And yes, it's very frustrating when everything you have, when you have a hammer, everything's a nail. And that's an issue in healthcare today, which is why we have so much pharmaceutical therapy being dispensed. Somebody says they're depressed. Most doctors don't say, oh, let's figure out why you're depressed. Are you depressed because you're not getting sunlight? Are you depressed because your dog died? Are you depressed because you're isolated? Do you have an imbalance in the brain, chemical imbalance? No, we give the same person, we give all those different people the same therapy, an antidepressant, when one may need sunlight, one may need a new group of friends, so we're not really looking deep enough for 9 out of 10 of the problems that we see.
You raise a really important point, and I wanted to get your thoughts on this. So we talk about treating symptoms, and then we talk about treating a root cause. And I know that the term root cause is thrown around a lot more when you're coming from an alternative perspective. Me being an Ayurvedic practitioner, I like to think about root cause as well. What does root cause mean to you, and how is it different than, say, someone that says, well, we look for genetic causes, and isn't that a root cause? What do you think root cause encompasses, and where do you think we're falling short with the conventional approach?
Well, the way I want to say, genetics are not our destiny, right? Your genes are not your destiny. You can have the genes for diabetes, but you may not manifest diabetes. It's going to depend on your epigenetics, the genes you turn on, turn off, your lifestyle, and so on. So your genes may determine if you're going to have something like Huntington's chorea, but that's not the majority of people that we see. We know 70 to 90% of chronic disease is related to lifestyle and environment. So the way I teach it to my patients is very simple. I say, if you have a tree and the tree is not doing well and it has some sick fruit on it, what are you going to do? And most of my patients will say, oh, I'm going to cut the branches off, but someone else will say, I'm going to fix the soil. I'm going to fertilize the tree. I'm going to make sure it gets enough sun, gets enough water. So what I have my patients do is I have them literally label the tree, because by the time they come to me, they have all these labels: high blood pressure, diabetes, depression, arthritis, all these various labels. And then I say, okay, Western medicine will say, let's go up and cut off the branch, or let's give you a drug for every different disease you have, or let's go in and look at the soil, going back to your concept of root cause. So then we just label the roots. And for me, it's about micro and macro nutrition, physical activity, sleep, exposure to toxins, how you respond to stress and tension, who's your community, who are you connected to, how do you live your life, right? So no matter what disease, and then I have my patients work through it. I say, do you think your diabetes could be related to your micro and your macronutrients? And everybody says yes. Do you think it could be related to your physical activity? Yes. Do you think stress makes your blood sugar worse? Yes. Not sleeping, that's a form of stress. That makes blood pressure, blood sugar, weight gain, everything worse. So when you start to look at it and say, okay, I have all of these things, how can I transform my life to create health? And that's how I like to think about root cause. And it's an easy way for my patients to really get the picture very clearly.
That was wonderful. Thank you. You mentioned this twice already, the act of creating health, which I think is a very important distinction that you allude to. And in fact, I saw that you were very involved in creating various standards of care for integrative medicine. And I think that it's very important and probably relates to the actual principles, because if you want to create standards to achieve this act of creating health, you have to have some standards. And I know you've been actively involved in that. Can you tell us about the principles of integrative health and how do you envision that? Because it's great to say we want to create health, but then how do we put those tools in there to help physicians to get to that point?
Right. So I think on the philosophical level, I have to say love is the greatest healer. So to me, it's everything about connection to a person or a patient or a client, everything about your relationship and how you connect with someone. To me, that's number one. And then when we think about integrative medicine or integrative health, I think about all the global healing traditions. So if we go back to the tree concept and we say, how do we get to the underlying cause of what's causing diabetes and hypertension and central weight gain or depression or eczema or psoriasis, we then go and look in the soil. And so when I evaluate my patients, I'm looking at their micronutrients. I'm looking at the micronutrients within their cells. I'm looking at exactly what they're eating. I'm looking for food sensitivities as a source for inflammation. I'm making sure people don't have sleep apnea. I'm looking at how are they doing emotionally? Are they depressed? Are they anxious? Are they under an enormous amount of stress? And then what I like to do is I like to go into my much broader toolbox now, which is much larger than just drugs and surgery, and start to pick out what can I do and as a team for us to transform someone's health. And it may be that I'm going to use a Vata diet in a patient with atrial fibrillation, right? Or it may be that I'm going to teach transcendental meditation to someone with hypertension and coronary artery disease. So then we can really personalize what an individual needs, not only personalize the food for them, personalize the nutrients, but also look at their life from a body, mind, spirit approach. And I really believe that if people are happy and they have joy and they have a purpose in life, that health and making healthy decisions comes naturally out of that space. But when people are depressed and angry, upset, stressed, they absolutely don't make the best choices. So it really is individualized, and that's how I approach it.
You know, that was a really beautiful explanation. I love the way that you threw in the Vata diet as well and the transcendental meditation, because it really does come down to an integrative approach. I think there's no question from what you're mentioning that really getting people to be more in touch with who they are and thriving a bit more is the key. What do you think would be the barriers to integrative medicine, or are there any barriers, and how can practitioners build that into conventional care? What do you think are the steps they need to take?
Well, I think the biggest barrier is that those of us who've gone to conventional medical school learn nothing about nutrition. We learn nothing about nutrient deficiencies except for the extremes. So what does somebody look like when they have scurvy or
Right.
pellagra, right? Or rickets,
I think that's very true.
right?
That is so true.
You know, so we have these extremes that we were taught, and we never really were taught to put into clinical practice the role for micronutrients and chronic disease. You
Totally
don't
agree.
learn, right? And you don't learn about the body-mind connection. Nobody talks to medical school about purpose in life and joy, and you know, you don't.
So true.
You don't get
Joy
that.
in medical school. What a concept.
Right. And you spend all this time in medical school learning about things you're probably never going to see in your lifetime. Like I can remember memorizing the life cycle of Clenorchis sinensis and all these parasites and things, which, you know, if I'm not practicing tropical medicine, it would have been much more beneficial to me to learn about nutrition and micronutrients and the mind-body connection and the role of the circadian rhythm in life and so on and so forth. So the Academy of Integrative Health and Medicine was really created to educate predominantly physicians, but clinicians of all types to work together. Now, as an MD, I had to go and learn this. I learned it through the American Board of Integrative Holistic Medicine. I remember going to my first conference and sitting there and hearing about how nutrition, dairy, I'll never forget, dairy causes sinus congestion. And I thought, what? This is crazy. And I have to tell you, it's absolutely true. Or gluten sensitivity is real. And all of a sudden, I started to learn about these things that were never mentioned in medical school. And I realized I have a whole path now that I can incorporate into my practice. Now we're talking many, many years later. So education of clinicians, that's the role of the Academy of Integrative Health and Medicine. That's critically important, because if we don't do that, then we're never going, where are people going to go when they want this kind of care? Someone listening to this podcast is going to say, hey, maybe my problem could be helped by micronutrient repletion, or looking for food sensitivities, or fixing my microbiome, fixing my gut, or learning TM meditation. So I'm not such a, I'm not so reactive in everything that I do. And then they have to find a practitioner that can speak this language. And my goal is to get those practitioners out there.
Mimi, I think this is so important, and everything you're saying resonates with me so deeply. And Hadar, I think you can agree that when we went through medical school, one of the reasons I even went to Ayurvedic training was exactly for this reason. I went through medical school and I wasn't learning about what it means to have joy, or what it means to have love, or what it means to have a sense of what you're eating, or the diet that you're taking, or how your actions make a huge difference. And it is missing in the curriculum. How do you think we could bring this back to conventional medical schools? Because I know you've created a very nice program for practitioners to go and get that education. But is there something that we should also be thinking about of introducing this earlier and earlier? Are there things that you're doing now, or is there things that you think we should be doing to try to encourage our younger colleagues to learn about these aspects?
Well, the Academy for Integrative Health and Medicine has about 90 chapters now all over the country, where we're getting to both the young and the old.
That's fantastic.
Right. And within many medical schools right now, I think the number is up to 81, there's integrative medicine curriculum, usually part of a rotation within the internship or primary care tracks, but there's more and more emphasis in this area. And as we get more clinicians trained and more people educating the young ones are going to learn this. So it's just a matter of hitting that tipping point. So it is happening. Medical schools are starting to put this into curriculum. And then you may be following some of the literature right now on physician burnout. And physician burnout is huge. Across the board, right?
It's an epidemic almost.
It's an epidemic.
I wanted to ask you about that. Absolutely.
Right. And it's an epidemic because for many, many reasons. And I laugh when I read some of the stuff that's coming out. They're saying, oh, it's because of the electronic health record. It's not because of the electronic health record. It's multifactorial, right? It's dissatisfaction with people not having the joy in the service of medicine, right? Medicine is a service, and that joy is lost. And yes, the electronic health record may be a piece of it, but there are lots of other pieces that are equally as important, including having some life-work balance and, appreciation. And, we can go on and down that road for a while. But the reality is this system we have to get from a disease care system to an actual health system. And personally, I'm not going to spend too much more time in my life trying to transform healthcare systems that need to focus on acute care. I mean, if you have a heart attack, you need to go to a trauma center. You need to get your angioplasty and your stent. If you get hit with a car, you need to go to a trauma center. And I wish all of those hospitals have acupuncture available and guided imagery and my goodness, a good diet, proper nutrition for people that goes beyond Ensure, for heaven's sakes, right? So, but at the same time, for all of the people out there that is saying, I'm seeing every day in my practice, all I'm dispensing is pills. And for those patients that are out there that are saying, I'm tired of taking 16 drugs, we need to create clinicians who really know about health. And there's a whole science of health. There's a science of health that we need to bring into clinical practice. We need to translate that science of health into practice, just like we translate the science of disease into practice. And that to me, if we don't do that and we don't have consumers saying, hey, I want a doctor that thinks this way, I want a clinician that is going to teach me how to get healthy, or I want a team that's going to teach me, which is more important, a team that's going to teach me how to be healthy, we're never going to turn this around. And it is imploding all around us right now. Not only burnt out physicians, but 20% of the gross domestic product going to healthcare. We spend more than any other country, and we don't have the best health outcomes. So something is not right.
Mimi, that was absolutely true and fantastic. And back to the point about nutrition, I remember when I first met Raja, that was one of our first topics of conversation, literally in our first conversation ever, was about the lack of education about nutrition in medical school. And I'm glad to hear that there's a movement, and over 80 medical schools are actually acknowledging the need to do this. And one of the themes that seems to be emerging and relates also to physician burnout is your idea of a connection with a patient, which you mentioned earlier. And I think it's so true. I think if a physician is connected to a patient, then they are happier because they're able to achieve much more. Because I think a physician now sitting somewhere, in the country listening to this may think, this is all great, but, I tell my patients, you need to lose weight. I tell my patients, you need to eat healthy, but it's hard because there's lack of what we call, for lack of a better term, compliance. And I'm in the setting of managed care, that all these barriers that are put in the way, I think, are part of this multifactorial problem that you were alluding to. So thank you for acknowledging all that and putting it so eloquently. I want to move on because I think we have a special treat coming up to answer some of these concerns of physicians with actual evidence. And I think you will be coming, in fact, I know you'll be coming to the Integrative Dermatology Symposium to tell us about the actual evidence that supports integrative health approach, which I think is a part that we're not going to get into today, but is really important. But perhaps you can share with us just one or two pearls that you use in practice that is based on good evidence, that you tell any clinician you meet, here, that's something you can do. It's based on good data and sort of easily to achieve.
Well, I think the first thing everyone can think about is, how do I decrease inflammation? I like to think of final common pathways of disease. So inflammation, oxidative stress, and immune dysfunction are sort of three of the common final pathways. So even if you just say, I'm going to get my patients less inflamed, and I'm going to get them on an anti-inflammatory / Mediterranean diet. And I don't mean Mediterranean diet of pasta and cheese. I mean real greens and beans, right? I'm not talking about pizza. But if you just look at that and you say, okay, Mediterranean diet has level A evidence, for example, for cardiovascular outcomes, right? And it's way beyond just the Lyon Heart Study and the PREDIMED study and so on. So if you're going to do something today, you're going to teach your patients how to eat, and you're going to get them off of sugar and simple carbohydrates. We know, evidence-based, that the higher the hemoglobin A1C, the smaller brain tissue gets, literally shrinkage of the brain. We call, dementia, type 3 diabetes. Get people off the sugar and the simple carbohydrates. And get them walking, right? So even if we do those basic things, if you look at the hypertension literature and you look at, yes, everyone will quote the DASH diet. Well, yes, low sodium diet's important in many, many people, and I recommend it. But take a look at transcendental meditation for hypertension. 48% reduction in heart attack, stroke, and sudden death. And that has been validated. Mortensen's work in congestive heart failure, coenzyme Q10, 300 milligrams a day, less hospitalizations, decreased morbidity, decreased mortality in people with stage 3 and 4 heart failure. Migraine headaches, acupuncture, hands down, great data on decreasing headaches, decreasing pain medication requirements, decreasing days lost at work. Again, looking at Butterbur for migraines, level 1 level A evidence using butterbur for migraine prevention outdid propranolol, which is something we've all been taught to use for migraines in medical school. The list is endless. I could go on and on with this. And the reality is we do have a science of health, and we need to apply that science of health into clinical practice. And if nothing else, if you don't know where to begin, you can begin with nutrition. And if you don't know anything about nutrition, you can go to get a low glycemic index diet and teach that diet to your patients. Get them off the sugar and the simple carbohydrates. I mean, that's a first step that everyone can do. So look, there is lots of evidence out there.
Wow, I've asked for a couple of pearls, and here I got already 3 chapters. I thank you so much. This was great, and I can't wait for your talk coming up at Integrative Dermatology Symposium. This should be fantastic. And thank you for mentioning inflammation. First, we're in charge of the skin part of the body, and see certainly where that end pathway meets of inflammation. And classic example is psoriasis and cardiovascular disease, and how there's emerging evidence even in that specific case of psoriasis, how anti-inflammatory quote unquote diet can help. So I think we'll stop here, and you certainly gave us a great flavor. I can't wait for further conversations. I want to thank you very much for your time and your points that were very important to us in practice.
Thank you for having me. This is great. And I just want to mention, if we have a second, that if clinicians are interested, go on the Academy AIHM website, and there's lots of online learning that people can access.
Absolutely. And thanks for sharing that with us too, Mimi, because I think this is definitely a groundswell to movement. And I think we're all moving in that direction. The patients want it. We want it. I think, as one of my students say, it's a great time to be alive, and the time is now.
Yay. All right.
All right.
Thank you guys so much.
Thank you for tuning into the LearnSkin podcast with Dr. Raja and Dr. Hadar. We would like to take this moment to tell you about our upcoming 2nd Annual Integrative Dermatology Symposium to be held at the Coronado Island Marriott in San Diego, California. This program will be 3 days of jam-packed information, including case-based discussions and multiple perspectives on topics such as psoriasis, atopic dermatitis, diet and the skin microbiome, cannabinoids, hair loss, traditional Chinese medicine, and much, much more. Go to www.integrativedermatologysymposium.com and register by July 31st, 2019 to take advantage of our early bird special. We look forward to seeing you there.